can wreck your life. When you're hurting, it's hard to enjoy anything, but help is available. We welcome Dr. Christina Captain from the Sarasota Center for Acupuncture and Nutrition to explain how she can help ease that pain. We are so happy to have you here today.
So good to be back with you, Linda.
So all pain is not the same.
Well, definitely all pain is not the same, that's for sure. And what I really want to focus on today is what is considered acute pain versus chronic pain. So when we think about acute pain, that's something that happens just recently. And like, let's say you sprain your ankle playing pickleball, but it's like a minor sprain, but you really want to go get it treated. So in about 10 days, it's still bothering you. You come in, or even 3 weeks, you come in, we treat it, or you get treatment elsewhere, and it gets better, and then you're good. Maybe you only need 2, 3, 4 treatments for that particular issue to be resolved. But chronic pain, that's something that, well, you sprained your ankle at pickleball, but you're a tough dude, so you're just going to keep playing. Maybe you tape it, maybe you ice it, and it kind of gets better. You keep playing, keeps hurting, keeps hurting, keeps hurting. And then it's 8 months, and now it's hurting when you're sleeping, and now it's hurting when you're walking, and now it's hurting just when you're doing nothing, and you don't know what to do about it. Now it's chronic. And so when pain is chronic, it's a pattern that's set in the body, and it has to be now adapted and changed and relearned as to not hurt.
Oh my, so you have to treat those very differently.
Right, so instead of just a few sessions, you may need more chronicity of treatment. It needs repetition to create adaptation. Adaptation is when the body goes, oh, I don't have to do this pattern anymore. I don't have to have this inflammation. I don't have to hurt so much anymore. And that's why acupuncture is much like physical therapy in that sense. You have to go to PT for how long?
Oh,
2, 3 times a week for weeks and weeks and weeks, right? And then they drop you down to 2 times at 1 time. It's the same thing for acupuncture with a chronic problem. Think of it as physical therapy for your nervous system.
Oh, well, that sounds very good that we have something like that. Explain what acupuncture really is and how it works.
Right, yeah, so acupuncture has 2 distinct perspectives. One is from the Eastern medicine perspective, which is kind of artsy, that talks about when a very fine, thin, meaning thin, sterile needle is placed in a specific anatomical location, it can help the flow of this vital energy called qi, which manipulates all the body and helps balance the body and reduce pain. That's sort of the artsy Eastern medicine focus. But biomedically, we know through research that acupuncture has measurable, distinctive changes, substantiated changes, and they're significant in the body. That means that we are really changing endorphins in the brain, lots of things in the central nervous system and the parasympathetic nervous system, sometimes, right? So that's what the body does everything with, including pain perception. So we can increase circulation for blood flow to tissues for wound healing, and it's great after surgery because of that. It can calm down stress and cortisol levels, balancing hormones. We can do it all with acupuncture, and that's the biomedical perspective.
And it's so funny that we knew it worked, maybe thousands of years before we knew exactly scientifically why it worked. So what's the difference in dry needling and acupuncture?
Okay, so there's a lot of political issues around dry needling, right? So dry needling is an add-on technique. Anybody that has education around anatomy, like chiropractors, physical therapists, MDs, DOs, acupuncturists, can all perform dry needling if they're trained on the add-on, which is maybe a weekend course. This uses a very long, thick needle and goes very deep into the body, basically to manipulate mechanically the trigger points of the body, which are stuck muscles, basically. Going in deep, it's a painful procedure typically, okay? Versus acupuncture, which uses shorter, still thinner needles and goes less deeply into the body and also activates points that deals in patterns. The other thing is, like I said, the education around it is an add-on. So it's something that you add on technique to somebody who's not used to using needles. When an acupuncturist does dry needling, they're already used to using needles. They've had a master's degree already as a minimum for acupuncture education in Eastern medicine. Someone like me who's gone off and got the doctoral specialty as well, that's even more education around the handling of needles and safety. So it's a big difference between dry needling and acupuncture.
Oh yes, so you need to choose your doctor very, very carefully when you're doing either of these procedures.
Sounds good, yes, absolutely.
So I understand that one thing that makes your practice very different is you like the difficult cases. You like to work with people who've been suffering so much for so long.
We do. That's what our specialty is. We want somebody who has not gotten help anywhere else, who's had pain for years, maybe decades in fact, and we want to help you. And so that's our total specialty. Come to us, we're going to go deep, we're going to find the root of the problem, we're going to treat you as long as we need to help you reduce your pain. So that's what we like to do. We really don't like those, I sprained my, we'll treat you if you sprained your ankle pulling out a hibiscus bush or falling at pickleball, but I really want somebody with fibromyalgia who has that really amplified pain, just stubbing your toe or hitting your hand on a coffee table. For a person without fibromyalgia, it doesn't feel like anything.
Oh.
For somebody with fibro, bam, it feels like you're going to die. Your hand needs to get cut off.
Well, let's hear from one of your patients and what she has to say about the treatment.
First time I walked in, I remember distinctly feeling safe and comfortable. I found a sense of serenity in the environment. I now am averaging 7,000 steps a day. Got off the bicycle, I'm walking. The Sarasota Center for Acupuncture and Nutrition is the most meaningful, helpful, effective, and comfortable place I have ever been treated at.
That's wonderful to hear. And you can learn more about the Sarasota Center for Acupuncture and Nutrition by visiting them online at scansrq.com.